Now we will discuss about pelvic joints. There are 4 pelvic joints. Okay, whenever a question is asked, okay, explain about pelvic joints. First thing should come in our mind that there are 4 joints. One, symphysis pubis, very important in midwifery also. So anteriorly there will be symphysis pubis, 2 sacroiliac joints here, 1, 2, and 1 sacrococcygeal joint. Okay, we will discuss them one by one. The symphysis pubis is the joint formed by the junction of 2 pubic bone. Okay, so one this hip bone, 2 second this hip bone. Okay, or these are the pubic part of these hip bones. So when both pubic bone attaches to each other and there will be a fibroelastic cartilage in between, so this joint is known as symphysis pubis. Next is sacroiliac joint. Sacroiliac joint, as name suggests, sacrum and ilium. The joint will between sacrum and ilium is sacroiliac joint. So 2 sacroiliac joint will be there. This one is right and this one is left. Okay, these are strongest joint in our body. Okay, and because they bear the weight of our body, they join the ilium join sacrum and connect the spine to pelvis. So our spinal cord or the vertebral column is attached to the hip bones. So this, after attaching these joints are formed and all these 4 bones form bony pelvis. Third one, sacrococcygeal joint. Sacrococcygeal joint is formed at the base of the sacrum. Okay, and coccyx articulate with the tip of the sacrum. So this is tip of the sacrum and this is coccyx.